Welcome to Working with Parents, Caregivers, and Guardians. This is the third of 10 modules in the course, Healthcare Transition Training for Healthcare Professionals. By the end of this module, you will be able to describe 2 frameworks for working with families during healthcare transition, name at least one strategy to engage caregivers during the process, and apply concepts from previous modules. Families have an important role in conveying information to their children. During the healthcare transition, patients learn to use their medical knowledge and to become responsible for conveying medical information to healthcare providers. Healthcare transition dovetails the developmental model of child-family professional partnership. Key strategies of this model include modeling and encouraging open and supportive communication with the child and the family, identifying and acknowledging the values and the priorities of the family, affirming the strengths of both the child and the family, identifying goals that are shared by the family and the provider, and then developing a joint plan of action to address stated goals. The shared management model uses a lifespan approach, acknowledging that caregiver and cared for roles change over the decades. To become a mature adult, youth must first feel competent and confident in their ability to accomplish tasks independently. The final stage of family development is interdependence, where individuals share responsibility for carrying out life's tasks with mutual support, respect, and effectiveness. Use this model to show parents or caregivers how their relationships with their child and with providers evolve over time. This approach prepares patients to manage the medical aspects of their condition as an adult. This model is also compatible with the Florida algorithm and with the Bright Futures guidelines. In Stage 1, the provider leads care, educating parents about their child's health condition and building a working alliance with them. The provider has primary responsibility for managing the chronic condition while parents carry out the care plan. In Stage 2, parents possess the knowledge, skills, and experience for a greater level of responsibility in the management of the condition. Providers support parents in this role. The growing child is an active participant, learning from parents and providers. Early adolescence is the time when families begin Stage 3. The young person begins an increasing level of responsibility for condition management. Parents provide oversight and support to their child with a receding responsibility to direct care. Providers support parents and patients, preparing them for the healthcare transition. In late adolescence and early adulthood, families shift into Stage 4. At this stage, parents and caregivers are available to the patient for advice and support. The young person is now the healthcare supervisor. As adults, they have the legal rights to make independent medical decisions and the responsibility to direct their own healthcare.
It's important to refocus them as soon as possible to, hey, even though we got this as a diagnosis, what are we going to do about it? And let's move on, and let's do everything possible to allow this child to reach his or her greatest potential.
It really gave us something to think about in terms of the future and to start planning for the future. Children, particularly when you start young, they take a tremendous amount of pride in being able to answer their own questions, to be knowledgeable about their own health care. When you're 2.5 and 3 years old, you're just very pleased with yourself that you can answer questions that maybe you've heard mom answer before, but now it's your turn.
Jimmy Olsen had cystic fibrosis, not Mrs. Olsen. So therefore, it was important that he understood this and that he understood that he had to take care of himself.
I was never looked down on because I was younger. I was always asked the most serious or direct questions about my health were asked directly to me, and they valued what I had to say about it.
I think the earlier that we can begin to having conversations with kids about any aspect of their health care, it's at a time where they're looking for support from their parent. They're looking for support from their physician. As they get older, they really don't want anybody's support. Going away to first grade was a time that could mean transfer of responsibility from mom to the teacher or it could be a transfer of responsibility from mom to Jim. And my preference was that we begin to look at transfer of responsibility from me to Jim. So I was able to convince them that we could put the pancreatic enzymes in his lunchbox, and that I wanted him to set up his own mistreatments, and I wanted him to clean out his own equipment, and I wanted him to be responsible for that.
And normally what we tried to do by the time a child reached 9 or 10, we expected them to really be taking care of everything. By that, being responsible for taking their own medicine, counting out the pills, taking the pills, even doing a lot of the partial drainage.
I think to develop that independence in your children, you just have to expect them to be independent, but teach them that independence early, and lead them along the way in daily activities.
Some parents and caregivers fear that their child will be overwhelmed by medications, therapy, and equipment needs. This is especially difficult when parents know that potential failures could have serious health consequences or shorten their child's life. Some parents may be reluctant to allow their adolescent to attend social activities independently, knowing the likelihood of a seizure, asthma attack, or low blood sugar level. Many youth are genuinely overwhelmed by how much there is to learn about their condition. Adolescents may have a preference for their parents and caregivers to be the experts. This section examines ways for parents and caregivers to transfer their knowledge to the patient. Parents and patients must conquer these fears by transferring the expertise. The patient has limited knowledge of their condition. Many parents are experts in their child's condition and keep up with the latest research. The physician's role is to encourage the transfer of expertise from parent to patient. Focus on concrete tasks that address specific fears or concerns, such as developing a plan for emergencies, describing their health condition and their immediate needs, alerting providers to recent changes in their condition, and managing tasks in their health maintenance routines. Remind parents and caregivers that it is important for them to allow and even encourage their growing adolescents to make small decisions for themselves, for example, in choosing their school activities or in their appearance. The patient will need time to practice different activities while they are learning. After the patient observes their parent or caregiver complete a task, the patient is ready to practice. It is important for teens to spend time alone with their healthcare providers and build an independent relationship with these professionals. This will also assure that they get the best possible information about the anticipated course of their chronic health condition. The next few slides will identify ways to use these strategies during appointments. Encourage parents and teens to work together, the parent coaching and the patient rehearsing. The path to independence provides further guidance on using the shared management model with patients and families. Use the shared management model to reassure caregivers that their adolescent doesn't need less parenting, rather parenting in a different form. The older a child gets, the less they need to be controlled and the more they need to be taught, encouraged, and guided in the fine art of making decisions. Teens need a chance to practice. Talk to parents about the lifespan developmental perspective. Teach parents how important it is to support rather than fight their child's efforts towards independence and self-reliance. These are necessary steps and missteps while their teen is practicing to go solo. Reflect on one transition-age patient in your practice and their family. Consider potential benefits and barriers for using the shared management model with this specific family. Write down a few ideas on how to introduce and use the model to enhance this patient's transition. The slide will automatically advance in 1 minute, giving you time to record your thoughts. The Seattle Children's Hospital Center for Children with Special Healthcare Needs website offers tools to address the parent's or caregiver's gradually changing role during transition. The introduction of healthcare transition is best accomplished when the child's health and family life are stable. Nonetheless, it is important to start early. If a family has not yet started preparing for transition, the time to start is now.
I think the greatest thing that my parents did for me in terms of preparing me for the college world and managing my own care was the fact that they made me do it before this. I realized from the start that I couldn't rely on them as heavily, that I needed to do these things for myself. My mother in particular, she's always like, well, you need to do X, Y, and Z. Like, there were a lot of days she would say, have you done this yet? Have you done this yet? And if I hadn't done it, believe me, it would be done then. So I think that was one thing, that they were always there reminding me and, having me do these things. So that now I just do it. So.
Before closing the module, let's review some external tools for working with parents and caregivers. Independence and self-care is the building block for greater goals and dreams. Prepare your patients, parents, and caregivers by building gradually. This process requires time and practice. Use the links from this course's toolkit to access the resources from this module. Using the strategies from Modules 2 and 3 will improve your ability to assess patients' transition readiness. You can pause the presentation for a quick break or continue directly on to the next module.